Varicose veins occur when the valves inside the superficial veins break and blood, instead of going back towards your heart, travels in the wrong direction and goes down. Usually what happens to cause a varicose vein is that you either have a job where you stand for prolonged periods of time, women once they've had pregnancy, and then frankly just people have genetics where they'll tell you, my father had varicose veins, his father had varicose veins, and now I have varicose veins. Varicose veins are diagnosed usually just by the appearance on the person's body. You can see obvious bulging, large veins, and when the patient has that, then they usually come in and we get an ultrasound to evaluate exactly the extent of the damage. You can get a superficial thrombophlebitis, just a minor clot within the vein, which can hurt and cause a substantial amount of pain, but it usually isn't going to harm you. Over time, however, varicose veins and venous insufficiency can lead to venous stasis ulcers at your ankles, like the gator region of your leg. And those wounds can be very troubling to a person and demanding on the healthcare time and money. And so essentially, we would like to treat them before the person ends up having venous stasis ulcers and having to go to wound care clinics. Furthermore, there may be other issues related to the varicose veins. There's a syndrome called May-Thurner syndrome where you have compression of the iliac arteries on the veins, and sometimes you need a more extensive workup for your varicose veins. And we usually check that even when we're getting our basic ultrasound on a patient with varicose veins. But then we can, because of the fact that we're all vascular surgeons, we can take you to perform a venogram if necessary and also fix that problem, which would make it less likely for you to get recurrent varicose veins after you've had a procedure. There are multiple treatment options, and a lot of it is based on the amount of damage that you have. So it can range from simple things such as excisions, where all we do is make tiny little 3mm or 2mm nicks in the skin and pull out varicose veins. Or it could be that you have a fairly large vein that is broken, such as the greater saphenous vein or the lesser saphenous vein. And in that case, what we do is we use ultrasound-guided access to get into the vein, and we ablate the vein. There are also different foam sclerotherapies that are available nowadays for varicose veins. And at Vascular Institute of the Rockies, we have all of those capabilities to treat any problem that you might have with varicose veins.